The dashboard is designed to provide a real-time operational overview of entire clinic, allowing users to monitor appointments, patients, subscriptions, pending tasks. So at the very top, you will notice a welcome personalized message. This helps identify logged in user and ensure that they are accessing the correct clinic account. So, as we support multiple user roles such as physicians, nurse practitioners, physician assistants, front desk staff, and admins, so each user sees information relevant to their role and permissions. So, I would like to start with the clinic section. So here you can see all the clinics that have been updated. Like the clinic module is where organizations manage or one or multiple clinic locations. Um, in order to add a clinic, you can simply click on add clinic, put the details and click on right below add clinic and the clinic will be added here. In case you want to make changes in existing clinic, you can click on edit and make changes and update. In case you want to archive, you can choose archive. You can also check by status which are active clinics, inactive, and archived. You can also search by name. Then we will be moving forward to users. The users module allows admins to manage all staff members. So in order to add a new staff member, you can just click on add new user, put all of their basic info and click on add user right below and a user will be added. In case you want to make some changes, so you can just click here in edit and you can make the changes and then click on the right below edit user and the changes will be marked. And in case you want to archive or mark inactive, you can do it from the under action. In case you want to check by status which all users are active, inactive, or archived, or in case you want to check by roles like how many nurses are there or medical assistants are there, you can click under role. You can also search by name or by NPN number. Next, we are moving to clients. Clients serve as centralized patient database. In order to add a new client, you can simply click on add client on right side, put all the details and then right below you can, after putting all the details, click to add client. Your client will be added here. In case you want to make some changes on existing client, you can click edit. In case you want to mark inactive or archive, you can do it from here. And you can also search clients by date of birth, by MRN number. MRN number is a number given by this portal. So here it says it starts from PAT. Or you can also search by client name. In case you want to search with the status, if the client is active, inactive, or archived, you can check from status. And in case this Homely MD portal will be connected to Go High Level. In case you're getting more leads, that will come under prospective. So when you're selecting prospective, these are the raw leads. You can call them and make them your patients. And in case I am clicking into one person's detail, in case you want to send a new invite, because invite is valid for 24 hours. If the patient have not signed up over portal, you need to send them another invite. So you can send from here. And if you want to showcase, like you want to add a new encounter, you can click from here. You want to change any details, you can choose the edit button. So here it will be overview of your client, what kind of active conditions he's got, allergies, and what kind of subscriptions. In appointment section, you can see how much appointments your client have made, if he's cancelled previous appointment or if he has completed. In encounters, you can see what appointments he actually went to, and here you can see if he has made any lab orders. You can understand what prescriptions are given to him. You can check who was the prescriber and date, and if it was refillable or not. So in case you want to understand this particular person's plan of care, you can check under plan of care. For his subscription, you can check under subscriptions and communication. You can listen to all the calls that this like that are made to this particular client from here. And in case this is for the documentation, whatever documents he will be uploading from his portal, you will be able to see here. And in case you want some signature from that person, you can upload a document here and request his sign as well. In case he has given you the payment card, it will show under payment cards, and this has all the vital information. Then here is the profile. In case you want to make any changes here, you can click on edit and you can make changes. And up next, we will go to appointments. Here you will be able to see all the appointments. In order to book a new appointment, you need to click on schedule appointment, and you need to fill all the details like client name. You can book either like in person or video appointment or at home appointment. So also you can also tell them like what kind of appointment it will be. Either you can write it down in reason of visit, so you can select the time zone, you can select the location, on which location the person is coming for an appointment. And you, after selecting all the required details, you can just click on schedule appointment below that, and you will be able to book a new appointment. In case you want to make any changes in existing appointment, as this is already completed, so here you can make only two changes, that is view details or archive. And in case if there is one appointment which is in detail, like in process, so you can make more changes like view details, you can view notes, you can cancel, you can mark no show. And in case you want to check like how many appointments were scheduled and how many were no show, you will be able to get all the data from status. You want to check who were the new consultations, how much came for initial consultations, how much came for follow-up appointments. You can check by appointment type. You can also use filter for location, and you can also understand like which client came for how many appointments. You can take data from client, and you can take data from by the name of clinician as well. And also you want to understand about one particular day, you can look into this calendar which shows weeks data, months data, and days data. So you can click accordingly and you can check. Next, we will go to encounters. Like this is one of the most important module. Encounters represents patient's clinical visit. So during every consultation, providers can document notes, diagnosis, their treatment plan, and patient's instruction. So in case you want to make any changes, you can click on edit, and you want to add any notes, or you feel like there are some assessments that you want to get, or you have some different sort of plan. So you can also write the prescription here. You can create a new lab order for your patient or client. Now, the task module, it improves collaboration between clinic staff. Like instead of relying on sticky notes or email, tasks remain organized within the platform. So in order to add a new task, you need to just click. You need to click on like search the client that you want to assign a task for, and then you can search assignee here, and then you can add the title or like book appointment or call client. In case you want to add more description, and you want to assign like due date, so after putting all the details, all you need to do is you need to create task. Click on create task on below, and then the task will be created. So while creating task, you need to set the priority. If you feel like there is a task which needs to be done on high priority, you can choose priority high, and you can put all the details like which client you are making this task for, and you can choose your assignee. You can choose the like title, call client, and you can add the description here, what it is for, and you can also add the due date, by what date you want this to done. And after that, you will simply click on create task. The task will be created and that person will get notified. In case you want to make some changes in existing task, you can click on edit, and you can make changes by clicking on update task after making changes. And in case you want to mark it archive, you can click here. So in case you want to see which tasks are archived so far, you can click on archive and you can see that. You can see active tasks, and you can check like which tasks are under high priority, so that your staff can start from high priority task. In case you want to filter by assignee, you can do that as well. You can filter by client as well. And in case you want to search by task, name of the task title, so you can do that as well. So, this subscription management is particularly valuable for aesthetics or wellness or hormonal like therapy clinics or weight loss clinics. So, patients can remain enrolled in recurring plans while the clinic tracks renewal and payment plans. So, here you can check, like, you can give reminders to your patients, like their next billing is coming, so they can already update their payment status, or they can do the payment beforehand as well. So in settings, you will be able to see all the intake forms, all the consent forms that you can send to your clients, and you can see you can make changes in plan of care, and you can have your own charge list here. And this portal also have dark mode and light mode. You can use it according to your comfort zone. Okay, in addition to like this clinician portal, Homely MD also provides a dedicated patient portal. So the goal is to empower patients by giving them secure 24/7 access to their healthcare information, their appointments, treatment plans, and subscriptions and recommendations, all from one centralized dashboard. This reduces the need for patients to call the clinics for routine information while improving engagement and overall patient experience. Here as well, you can see the welcome dashboard. Once the patient logs in, they are greeted with personalized dashboard that provides quick overview of their healthcare journey with the clinic. Like rather than navigating through multiple pages, a patient can immediately see upcoming appointments, subscription status, lab results, and personalized recommendations. So they are able to track their next appointments. Like the first card highlights the patient's next scheduled appointments. Also, in case they want to track their previous appointment, or they want to know if their previous appointment had any prescription, so they can track from here. In my appointments, they will be able to see all of their appointments. So at this time, these are made for like, these are in exam, they do not have any status update, so that's why. But here is the option in case the patient wants to cancel that, and he can also choose from like upcoming, from past, or from particular clinician, from location. The appoint He can also choose via appointment type and via status. And in case he wants to book a new appointment, it is very simple. New appointment can be booked from patient's portal as well as clinician portal. So he just needs to come here, book the appointment mode, and then the appointment type. Then he have to choose his own clinician, and after that he's going to choose the location where he will be visiting, and the time zone and reason for visit. And then after clicking on schedule appointment, he will be able to schedule appointment. For example, if we are choosing this clinician, so here he will be able to see the slots, This is just a demo call, so that's why there are no slots available, but uh, he will be able to see all the slots here. And from clinic's perspective, giving patients easy access to appointment information helps reducing like in missing appointments and decrease the number of scheduling related phone calls. So next, if we go to documentation, here he can see intake consent, and in case he wants to upload a new document, he will get the option. It's very simple. He just have to go and choose what kind of document he's uploading, and click on upload document. Subscription. So the next card displays the patient's active membership or subscription. Here it says you don't have any subscription yet because it is a demo. So next we have plan of care. Whatever plan of care patient will be having or client will be having will be displayed here. The lab of reports will be displayed here, and whatever supplements those are prescribed to this particular patient will be displayed here. So again, it's very simple. He can make changes in his profile by going into profile and clicking on edit, and in settings, um, he don't have any intake or consent form. Otherwise, he could have made changes here. And this also have light and dark mode. So that was all demo. So that concludes the demo of both clinician and patient portal. As you can see, Homely MD brings your clinical workflow and patient engagement together on a single platform, helping streamline daily operations while enhancing the overall patient experience. Thank you so much for your time, and we are open to take feedback and review from your end.